my student from Zahra University Formal Department of Radiology and Sonar, Physics of Radial Brain Meninges, name Fatma Mohammed Kadam.
Meningitis. It is clinical syndrome characterized by meningitis, the most common cause of meningitis as a bacterial or viral infection. Most causes of bacterial meningitis are concentrated in the back of the brain. However, under certain conditions, meningitis may be concentrated at the base of the brain, as is the case with pharyngeal disease and tuberculosis. Bacterial meningitis should be the virus and hormones condition in the differential diagnosis of patient with the headache, neck, stiffness, fever, and altered mental status. Act bacterial meningitis as medical emergence and delay in antigenic effect. Antimicrobial treatment increases morbidity or mortality. The reduction to have a kind of the brain of antibiotic, not delay the institution of antibiotic therapy, such a delay could increase the death rate. Neuroimaging can identify conditions that may predispose as bacterial meningitis, that it is induced in patients with head injuries, sinuous or students, skull fracture, and conductal anomalies, and Dacian neuromechanic studies are commonly used. It identify and monitor complications of meningitis such as the eudoric place, subdural infection, MPM infection, and exclusion of parenchymal abscesses and ventriculitis. It is important to identify complications early. Bacterial meningitis, which can be vital or cause serious health problem. Treatment for meningitis with antibiotic should begin as soon as possible. Viral meningitis is less severe than bacterial meningitis and has no specific treatment. Meningitis image test used to diagnose meningitis, lumbar puncture, CT scan, and MRI are just a few of the image tests that doctors use to make an accurate diagnosis when have meningitis. It is instilled that the health care team determined as soon as possible whether it was the virus or bacteria that caused the disease. A CT scan can also show whether there is inflammation in the skull or sinuses, which might be helpful in diagnosing meningitis. Additionally, a CT scan can help doctors determine the processes of respiratory disease, blood clots, bone or vascular disorder, some type of brain tumor, brain damage from a head injury, other disturbance. Most people with the meningitis undergo a CT scan before a lumbar fracture. We do this to ensure that there is no large lesion taking up space, such as a tumor which causes an increased pressure. Healthcare professionals involved in meningitis treatment and care might include pediatricians, internal medicine physicians, or family medicine physicians, emergency room physicians, infection disease specialists, neurologists. Meningitis treatment from family doctors to emergency room doctors to laboratory Technicians, this health service providers play a vital role in diagnosing and treating meninges, secreting corticosteroid meningitis. Early treatment of meninges with authorities might prevent some common complications of meningitis, and in the case of meningitis, patients might be assumed to have difficulty breathing. Oxygen therapy can help move more oxygen into the blood and tissue, and major serious problems sometimes can cause breathing problems that, if left untreated, can lead to serious problems including respiratory failure. Meningitis is a dangerous disease that can spread quickly from person to person. Find out how to protect yourself from bacteria who is meningitis diagnosed and its early stages. Symptoms of are even confused with the flu, but early detection and diagnosis of the disease can save a life. Here's what you should know.
MRI is often used in stations where until work as negative and requires a more sensitivity method, computed tomography. Conclusion: meningitis is an infection that occurs at the base of the brain, and it is most common cause as a bacterial or viral infection and is diagnosed on the basis of symptoms of patients who have headache, fever, and altered state, and there are other symptoms. Prostate treatment and oxygen image the brain by magnetic resonance imaging technology and TQ.